Well, there are lots of you that we are going to get to connect with over the next 3 days, but as a way of providing some clarity, because there's lots of acronyms and groups that are thrown around in this space, I'd love to start our time this morning with a little bit of a who's who showcase, so that you have a sense of what exists within this big umbrella of all these different organizations and units and groups and program offices, right? There's lots and lots of stuff out there. So we're going to do a little who's who showcase. And the purpose of this is for you all to orient yourself of like, ooh, that's a group that I want to go learn more about. Or this is an organization that I want to go connect with further at some point, and where you might be able to do that. So I'd love to invite 4 friends up onto stage. Please give me a warm welcome for Dr. Beth Ripley, Allison Emrine, Dr. Tracy Robolato, and Joseph Beadle. Wonderful, wonderful. I would love if these 4 wonderful human beings could just give us a little 2-minute overview of who you represent and where people might be able to connect with the groups that you guys are a part of here during IEX this year. So we'll kick things off with Beth.
All right. Can you all hear me? Yes. All right. I have the pleasure of introducing OHIL. OHIL is the Office of Healthcare, Innovation, and Learning. We are the large community that encompasses all of these amazing programs we're going to hear about. A few things to know about OHIL. First, what are we here for? Of course, we're here to innovate how we do care, learning, teaching, training, etc. for veterans. But really what we're here to do is empower all of you and all of our friends back at home to do these things for veterans. So OHIL, again, is the kind of parent community driving empowerment and really trying to kind of find the areas within each of the cool, unique programs we're going to hear about where things overlap and drive collaboration. So without further ado, I'm going to actually hand it over to talk about the 4 programs because OHIL is really the 4 programs in all of you. So Allison.
Thank you, Beth. Hi, everyone. I'm Allison Emrine. I'm the director of the VHA Innovators Network, but I'm up here representing the VHA Innovation Ecosystem, one of the programs within OHIL. The primary focus of the ecosystem is to foster the discovery and spread of innovative veteran solutions and solutions that we can take outside of the VA community as well, of course. We consist of 3 main components: the Innovators Network, the Diffusion of Excellence, and the National Centers for Innovation to Impact. And I had to write down where they all were so that you can check them out in some highlight sessions here because my memory isn't that great. But if you want to know more about the ecosystem itself, VHA IE 101 is today with Diffusion of Excellence Director Blake Henderson at 1:40. These are just a sample. There's a lot of spaces to see the work of the ecosystem. At 2:55 today in the Connection Cafe, which is a really unique experience that you all have the opportunity to participate in, really bringing together a community. We're going to talk about the VA Entrepreneurial Product Marketplace, which is our homegrown Amazon-like service, if you will, website that features VA employee innovations, innovative products that are for sale and available. Tomorrow, of course, the afternoon you will spend with Diffusion of Excellence at Shark Tank, which is very, very exciting. And then the Frontline VA employee experience, you'll hear from frontline employees on Thursday about their journey so far in innovation. And then throughout the 3 days, there are many, many opportunities to actually have some learning opportunities, some actual hands-on training opportunities. You'll learn pitching and storytelling, human-centered design, building your innovation strategy, so much more. But don't forget to check out that room if you want to learn a little bit more. So thank you all for being here. I'll turn it over to Ms. Tracy.
Good morning, everyone. I'm Tracy Robolato, and I'm here with a team from SimLearn. Woot woot. SimLearn is the VA's national resource for VHA's healthcare training. We're based out of Orlando. We have a 53,000 square foot simulated hospital. If you haven't seen it, it's really impressive, and I recommend it highly. Within SimLearn, we have 5 dynamic, multifaceted portfolios. And each one of those portfolios uses simulation and leverages innovative solutions to impact and improve veteran healthcare outcomes. You're going to hear several of our team members are here to present. We have some posters, and we also have a booth. I'm not going to tell you what SimLearn stands for. VA loves acronyms. And I'm not going to tell you what the 5 dynamic portfolios are. I'm going to invite you and encourage you to find them throughout the next 3 days to learn more about what we do, because it's super exciting. Thank you.
And good morning, my name is Joseph Beadle. I am the Executive Director for the Office of Advanced Manufacturing. And the Office of Advanced Manufacturing just was stood up this last year as a formal office. And it is really a culmination of 10 years worth of 3D printing and advanced manufacturing that's occurred within the VA over the last 10 years. There are 6 hub sites that we have. It's Puget Sound is the first, and then we have Pittsburgh coming on board. We have Cleveland, and I apologize. This is my first time being in front of a crowd in the last couple of years because of COVID and the rest. So we have Cleveland, and we also have Charleston as well, Richmond, and then Milwaukee. And so with those 6 sites, what our goal and our vision is that we're going to be able to provide a patient-centric and patient-specific 3D manufactured and other advanced manufacturing ways of care provided to our veterans, all 9 million of our veterans. And so that sense of equity of being able to provide that level of advanced care out to our veterans is going to be accomplished through the teams that we've got here. And you're going to be able to see 4 separate groups that are going to be presenting over the next couple of days. And there are also 4 booths out that I recommend everyone go and take a look at. The reason why I want you to go and take a look at those is because you'll be able to see and touch the actual 3D printed devices that we have and those that were manufactured. And like I said, these are patient-specific items. So that allows us to give a level of care for our veterans that you wouldn't be able to accomplish with something that you were going to buy off the shelf. And so that's one of our leading points is that we make what we cannot buy, and that'll be explained during the OAM 101s. But really, it's bringing together a fusion of the inspiration and innovation that's coming from individuals who are out there within the VA, and coupled with the clinical staff that we have, our doctors, nurses, technicians, et cetera, and are going to be working with engineers, people in academia, people from out in the public sector, private sector, who are our partners as well, and bringing all of that together into devices that can be used and can be seen by our veterans. And so when we're looking at what our vision is into the future, it's not that with those 6 hub sites, we won't be able to reach everyone at the start, but it's really to be able to show with the eventual goal of saying that seamlessly you can have a veteran walk into any of the sites within the VA and be able to have care that is going to be point of care manufacturing and delivered so that they have that device, whatever it might be, whether it's for assistive technology, if they're one of our amputees, or if they have trouble in their day-to-day lives, all the way up to if they're having a surgery, so you can see the models, the pre-procedural models that allow you to really give our patients the opportunity to be informed and understand what's happening at the same time as our surgeons are able to plan better with those 3D images. And I know I'm forgetting a lot, but we only have a short period of time, so I'm going to turn that back over to Beth.
I love it. And I have the opportunity and honor to also introduce our 4th group, which is CCPI. As we said, we like our acronyms, but that is the Center for Care and Payment Innovation. And one of the coolest things about working in the VA is that because we are mission-driven, our job is to provide best-in-class, world-class healthcare to veterans. And we're unencumbered with some of the payment models that have to be thought about on the private sector. And so CCPI is, in essence, this is the way I like to think of it, kind of harnessing that power to think about how we innovate around care and payment. Because care and payment, if you're not lucky enough to work in the VA, can drive how you practice medicine. So they are here to help us think again about what's really value and how do we drive value for veterans. And value is very hard to define. It's somewhat nebulous, but there is a kind of an equation for it where they say, it's the quality of the care and the outcome per unit cost. So we want to drive that best-in-class care in CCPI. They are doing some amazing work. They have a congressional mandate that allows them to kind of color outside the lines in the best of ways to think about this. And if you want to learn about CCPI, which I highly encourage, you want to show up to CCPI 101. It's on Thursday afternoon at 1 p.m. And I think that wraps us up. So welcome, we're super excited.
Awesome. Cool, yeah, give one more round of applause for our who's who. Thank you all. I'll let you back to your seats.